can't hear anything. Can you hear me?
Good evening, everyone. Happy Sunday. Welcome to ZÉRA Talks February edition, day 2. So for those who just joined our session, my name is Kai and I'm your host for tonight. As an introduction, ZÉRA is an online informative platform where you can find useful information ranging from pregnancy to postpartum. At ZÉRA, we highlight on well-being, learning, and healing. We aim to provide support to all you mothers out there, especially during this pandemic situation. Therefore, we are happy to introduce our very own community, ZÉRA Mums. So feel free to use our hashtag ZÉRAMums and share with us your journey as a mother. Tonight's webinar is brought to you by Hakam Malaysia, who is best known for their silicone breast pump, and Mosh Japan, who has been a go-to brand for thermal-related products due to their elegant design. So as you all know, we are giving out RM350 worth of ZÉRA Care Box to 2 lucky winners. So in order to be eligible, please remember to do the following 3 steps. So step number 1, like and follow ZÉRA, Hakam Malaysia, and Mosh Japan's Facebook and Instagram page. Step 2, fill up the Google form. And step 3, just remember to share this webinar out to all of your friends and family. And make sure your post is public so we can view it. In case if any of you missed it, just head over to our description box in our Facebook live video. We will pin all the details there. And also, if you're streaming on Instagram Live, please head over to our Facebook instead in order to participate in our Q&A session. The link can be found in our Instagram's page bio. And also, as an added bonus, Mom's Munch, who specializes in milk booster cookies, is giving away 20% discount exclusively to you ZÉRA moms. So simply just visit Mom's Munch Instagram page at MOMSMUNCH and quote ZÉRA Mom's Munch to enjoy your 20% discount. We will also pin this in the description box. So as an introduction of the webinar flow, it will be conducted into two parts. So the part 1 will be about pregnancy and part 2 will be about postpartum. At the end of the webinar, there will be a Q&A session. So if you have any questions, don't be shy. Just feel free to leave a comment and we will pick a few to answer them. So without further ado, let's begin. Allow me to introduce our first speaker of the night, Dr. Mai, who is an O&G specialist at Prince Court Medical Center. I'm sure some of you may have already heard of Dr. Mai since she is a columnist in several local magazines and press, including Day One Cosmic. Dr. Mai has been involved in research, both quantitative and qualitative studies related to pregnancy, umbilical cord hematopoietic stem cells, women's health, andrology, and also infertility. Tonight, she'll be covering on the topic antenatal care. So let us welcome Dr. Mai. Dr. Mai, you may start sharing your slides.
Hello, good afternoon. Hi, everyone. Let me just adjust my slide. Is it okay?
Yes, Dr. Mai, you can start.
All right, Assalamualaikum and good evening. Hello, everyone. Thank you for the kind introduction. I believe this is our first encounter. Thank you for having me. And also Dr. Liza is on board after me, following me right after this. I'm just going to keep this, it's a sharing session. I'm going to keep it simple so that everyone is able to digest what are you going to go through throughout your pregnancy. So what to expect when you're expecting, okay? So the slide is actually meant to guide what I'm going to say or share with you. And I will elaborate more on certain topics. Okay, so we'll go one by one. Now, basically, if you talk about pregnancy, after you got your UBT pregnancy test positive, urine pregnancy test positive, so the most exciting moment, then you will start thinking, so, first trimester, second trimester, third trimester, what I can do, what I can't do, and what will happen during labor. Will I be able to deliver with normal delivery, or shall I end up in a, cesarean section or operation to bring about my baby into this world safely? So the rule is that I would love to highlight tonight to everyone, whatever the mode of delivery is for the mother, the most important thing is that you understand as parents, your mother and also the potential father, delivery, our aim is to have a safe delivery, regardless whether it's a normal vaginal delivery or you end up with the instrumental delivery like vacuum or forceps, or the third or the last choice, that would be a cesarean section, okay? So all those will be, weigh and balance by your obstetrician taking care of you, which one would suit you to ensure a safe mother and also baby outcome. All right, so we'll go one by one. The first trimester, what I can do, what I can't do. Second trimester, what you expect. Third trimester, the labor, a little bit of labor and delivery progress. And of course, last but not least, the post-delivery period or puparium, or in Malay, we call it pantang session. All right, so for this, Dr. Liza will elaborate more on that. Okay, I'll focus on the first, second, third, and also intrapartum journey. Okay, so how do you survive the first trimester after having had a positive urine pregnancy test? Okay, what should I do? All right, let's say most of the time you will miss like 1 or 2 weeks of your menses, then only it triggers you to actually do the UPT test or urine pregnancy test, where you can actually buy at Watson or any nearby drugstore, all right, or pharmacy. It's very easy. Just dip it in the early morning urine. Okay, that's the best time to actually check your urine pregnancy test. Okay, once it's positive, what should I do? Okay, you're very excited, I'm sure. But most of the time, the first thing you need to do is to confirm your pregnancy, because sometimes when you have a urine pregnancy test which is positive, it might not always want to be a true positive. Sometimes it is also a false alarm. All right. For example, in women having polycystic ovarian syndrome, where they have a very high hormone LH or luteinizing hormone, and that can also give you a false positive pregnancy test. So what are the tests that I need to do to confirm my pregnancy? Okay, usually if you've got no other risk factor, for example, this is your first pregnancy, you've got no background history of ectopic pregnancy, that means a pregnancy which does not actually develop in the womb, but instead at the fallopian tube. Okay, this is what we call an ectopic pregnancy outside the womb. Okay, if you don't have that risk, most of the time, this patient will come and see the doctor around 8 weeks or maybe 9 weeks, not really that early. Okay, but if you have a significant history of ectopic pregnancy, or if you've got underlying diabetes or any medical disorder whereby you are already on treatment, I would suggest for you to check and see your obstetrician or any doctor to confirm your pregnancy as soon as possible. Why is it important? Number one is to confirm your date. Number two, to confirm this is actually an intrauterine pregnancy, or shall I say the baby is growing inside your womb. Okay, and if you have medical illnesses like diabetes or hypertension where you are already on treatment, some medication it is not safe to be used in pregnancy. Therefore, the doctor need to adjust the medication. So these are the first thing you need to do. Okay, go and see your doctor, confirm the pregnancy. How do you confirm? Most of the time, if you go to a clinic where they have a scan, so they can actually do an early scan for you, or what we call as dating scan. All right, usually we do it somewhere around 7 or 8 weeks. This is to confirm your estimated date of delivery. It is very important. Okay, the first trimester scan or dating scan. Now, then after that, what will happen in the clinic? Most of the time, the doctor will actually check your blood pressure, will weigh you, check your urine, okay, whether there's any evidence of some protein leakage or some sugar to probably suggest that you're having diabetes, early onset of diabetes during pregnancy. And then the doctor will also get a thorough history and of course examine you, okay, before she or he actually do a scan for you. Okay, so once you have done the scan, confirm the pregnancy, so most of the time then the question will pop up, doctor, what can I do during my first trimester? So I'm just going to highlight the question that my followers always DM me at my Instagram, okay? So number one, they will always ask me, okay, what can I take? Can I take pineapple? Can I take certain food which they think can actually cause miscarriage? Okay, whatever you take in pregnancy, as long as it is natural, okay, for example, your fruits is actually quite safe. It's just that you need to take it in moderation. Don't take it too much. Okay, for example, if you feeling so, how to say, tempted to eat pineapple, it's okay, just take one slice. All right, if you take two or three, then that can actually make your sugar your blood sugar goes up, then it will actually put you at risk of having diabetes later on. So okay, you can take, but in moderation. And most of the time, I would advise them to take a small but frequent diet. That means, you can take your breakfast, then a little bit of brunch, lunch, and then tea maybe in the afternoon, then dinner, then a little bit before you go to sleep. Why? During the first trimester, your body undergoing a massive physiological changes, basically, where your hormones goes up, your progesterone, estrogen. So it makes you a little bit nauseated. Some people have very bad vomiting. Okay, so any food, any smell can just trigger the vomiting. So I would suggest to take a small but frequent diet and try to avoid those food which is like spicy and oily. Okay, and maybe have a very strong smell, right? And don't forget, you're not eating for two. Basically, you eat as usual. Practice a diet, a balanced diet. 1/3 of protein, 1/3 carbohydrate, and half of it is actually vegetables and fruits. Okay, it's just that in pregnancy you need just a little bit of extra of 200 calorie. Okay, that is equal to two slices of bread with a little bit of plantain or margarine. Okay, so not eating for two actually. So those are among the common questions in the first trimester. If you have any bleeding, please go straight to your doctor. You shouldn't have any, how to say, a lot of bleeding during the first trimester. So usually if you have bleeding, we are a bit worried of what we call as threatened miscarriages. Okay, and doctor will actually help you to prescribe some medication to make the uterus more or your womb more relaxed. Okay, and the other question is, can I have intercourse during the first trimester? Because these are the moment where everyone is very worried that the intercourse or the sexual intercourse can actually trigger miscarriages. All right. According to all the studies, basically it does not harm your fetus. Do not worry. Okay, the baby is actually protected well, protected by the womb and also some amniotic fluid inside the womb, okay, the water bag. All right, so do not worry as long as you have no contraindication. That means your doctor say, okay, you've got green light to have actually have a sexual intercourse, you can carry on. All right, seek your doctor advice before you can go ahead, because sometimes in certain condition, for example, patient undergoing a high risk procedure like IVF. Okay, these are considered precious pregnancy. Of course, all pregnancy are precious, but IVF is much more precious. All right, usually some IVF specialists would actually advise the couple to be, how to say, to relax, abstinent from sexual intercourse for at least until about 12 to 14 weeks of pregnancy, all right, or gestation. So these are among the questions in the first trimester. Don't forget, first trimester, you need to have a lot of rest and drink a lot of clear fluid, basically to hydrate yourself and for your body to be able to adapt to the massive changes of hormones during this first trimester. All right. And then, yeah, I did mention just now, the first antenatal checkup is what we call as the booking. Okay, this is where the doctor will actually look through your history, examine you, and also do a scan for you and several blood investigation. The common blood investigation would be the checking your hemoglobin, all right, whether you've got anemia or not, and all the infectious screening. This include the HIV, VDRL, and hepatitis B. Okay, and not to forget your blood group. As I mentioned just now, the do and don'ts. Okay, remember, you're not eating for two. You're actually eating a balanced diet, sufficient for both, regardless whether you're carrying a singleton pregnancy or a twin pregnancy or even triplets. Actually, the calorie is more or less the same, extra of about 200 to 300 calorie per day. All right. Now moving on to second trimester. So this is actually the best moment throughout the of the three trimester. Basically, you're moving on to the second trimester where you feel you're more attractive. You're more how to say. Some will actually keep commenting on your flawless skin. Okay, it's because of the increase in the hormone of estrogen and also progesterone. So this is the best time where you actually have passed the moment where you have nausea, vomiting. You no longer have that. Okay, and this is the time where you tend to eat quite a lot. All right, how much you need to gain in the first 6 months of pregnancy? Usually not that much, but towards the end of the second and third trimester, then you start gaining a lot actually. So you really need to take care of your diet, a balanced diet. And usually in an average lady of about 50 to 60 kg lady, or I would say a lady with a normal BMI, we expect throughout the pregnancy, you would gain somewhere between 12.5 kilogram to probably about 15 kilogram, all right, maximum maybe 16 or 17 kilogram. Okay, but for those who have already have weight management problem, that is you're already in the category of overweight or obese prior to conception before you actually get pregnant. So usually we will allow during the pregnancy the increment of weight of about maybe 7 to 8 kilogram. Okay, and most of the weight gain is actually towards the second trimester and the third trimester. Can you do exercise during the first trimester? Well, we're talking about just now the first trimester. Most of ladies are actually quite overweight to do exercise in the first trimester because again, the thought of having miscarriages if they were to do a lot of extensive workout. Now, if you are already an athlete and you're already a yoga person or Zumba person prior to your pregnancy, it is actually quite safe to carry on. You have to know your body, basically. Okay, if you're tired, if you're dehydrated, do not go into extensive workout. Okay, you can do a simple workout like brisk walking, or just walking around your balcony or your garden. Okay, it's actually very safe. In the second trimester, where you are more fit, I would say, although the pregnancy is the baby is becoming heavier and bigger, but for those who are already fit prior to pregnancy, they can actually resume back their exercise, but with a lesser intensity. For example, you're used to uh, jogging. Okay, you can do it, but make sure don't do it alone. You have somebody to accompany you, and please do not go into the same phase that you used to do before your pregnancy. You have to adjust. Okay, in pregnancy, yeah, there are, if you look at the American or the UK ladies, they still go for swimming, they still go for jogging. All right, it's just that during this current pandemic, be careful of where you want to go. And of course, in certain, in most swimming center, they are actually closed because of the pandemic. So if you have your own pool at home, yes, swimming is actually one of the how to say, a good exercise for pregnant lady, especially if you are already past your first trimester. All right, it's actually quite simple. But make sure you know how to swim, of course, and there's always a companion, okay? Because pregnant lady, they tend to have cramps, and we do not want our ladies to have cramps in the water. It's actually very dangerous. All right. So in the second trimester, usually the mother will start having this what we call as quickening. Quickening means the baby start to give you a little bit of fluttery movement. It's not really a kick. Okay, this is somewhere around 20 weeks for 20 or 22 weeks for a first pregnancy, if this is your first baby. For those who have been pregnant prior to that second or third pregnancy, maybe they can feel it a little bit earlier, somewhere around 18 weeks, right? And usually in the second trimester, I would recommend, if you're able, all right, even though if you're not in the high risk group, I would recommend for you to do a detailed scan. So this detailed scan is somewhere around 18 to about, the best time is about 18 to about 24 weeks of gestation or pregnancy, okay? So where the fetal maternal specialist or a sonographer, which is expert in detecting structural anomaly, where they can actually see the baby, okay, and they will see whether there's any abnormal features, for example, in the hands, or on the leg, or on the face, okay. So and of course, internal organ like the heart, especially, to detect any abnormalities. So this, what we call as detailed scan or anatomy scan, is usually done between 18 to about 24 weeks, and the latest you can do it is somewhere around 28 weeks. If it's go beyond that, the baby is already big, so it's a bit difficult to detect all the small abnormalities. Okay, so yeah, as I mentioned just now, this is the best. This is the time where you actually gain your weight. Now, the third trimester, this is one of the trimester where the mothers start to have, you know, how to say, they are very anxious. Okay, how am I going to undergo the labor? This is my first time. I don't know what to expect. Is it going to be painful? Will my husband be able to accompany me during the labor process? Okay, these are among the questions that my patient usually asks. So it depends on where the institution is. All right, for example, at the moment, in my center, we still allow the husband to come in. Of course, because of the pandemic, both of you need to do a COVID screening. And I know some of my friends in the government, okay, as they updated me, at the moment, because of the pandemic, we try to reduce the risk of infection. Okay, so only the mother will be accompanied by the nurses. The husband is not allowed to come in. All right, and in the third trimester, okay, you'll be feeling the baby kick much more harder than what you feel in the second trimester. And usually, if you're already at 28 weeks, the baby is somewhere around 1 kilo, and when you are about 36 weeks, the baby is somewhere around 2.6 to about 2.8 kg, and by term, which is around 38 weeks or 40 weeks, the baby should be somewhere around 3 to 3.2 kilogram. I'm talking about an average weight baby. Of course, some would have a baby somewhere around 3.2 to 3.6 kilogram, the weight. But anything less than 4 kg, most of the time, we consider this is a normal weight, all right? Unless the mother is actually short stature. That means the height is less than 150 centimeter, all right? So probably for these ladies, um, trying to deliver normally might possess a little bit risk if the baby is more than 3 kg. But having said that, yeah, I had a few patients with 149 centimeters still able to give birth normally to a 3 kilo baby. It all depends on the assessment of your obstetrician during the third trimester. Most of the time, we will actually assess the patient somewhere around 36 weeks to 38 weeks. Okay, so what do I need to prepare for my baby arrival? All right, these are the common three questions my patient will ask me. What are the signs, symptoms, and how long my labor will last, and of course pain relief. All right, so let's go one by one. The common symptom, okay, you should be aware, mothers or future mothers. Okay, you have your water bag suddenly gushing from your private part. All right, all wet. Okay, this is like opening a tap water. Okay, so it should be clear, just like the tap water. It shouldn't be red color, which is blood, or a green color, which is probably the baby is already poop inside. All right, so anyhow, what color does when you have this so-called water break, all right, regardless the color, you should go to the hospital as soon as possible, because either you're really in advanced labor or your water leaks earlier when you're not actually in a true labor. So we are worried that sometimes the risk of infection to the baby is there. So yes, you need to go to the hospital for a proper assessment and checkup. All right, and that's number one, okay, water leakage. And number two, you have, of course, contraction. So how do I feel contraction? Contraction is something like your period pain, all right? If you have experienced dysmenorrhea, or what we call as period pain before you conceive. So, but it is more intense, and it spreads from the top of your womb, and it goes down, it spread downwards, all right? And the intensity increases in time. Usually it start off maybe about 10 to 15 seconds, then it can last longer than that, maybe about 40 seconds. And the interval is getting shorter and shorter. For example, you have it every 2 hours, then suddenly it becomes every hourly, then every 40 minutes maybe, then every 20 minutes. So if this occur, the contraction occurs, increases and remain constant throughout the day, then this is a sign. So you need to go to the hospital. And the third one is actually show. Show is actually a mucus plug. It's like a discharge mixed with a little bit of red or brownish liquid. Okay, so it's like a mucus plug. Okay, coming out from actually your how to say, the opening of the womb. right? Or what we call as cervical os. So it comes from there. It is a sign that probably your womb, the cervical os is opening up. All right, that is the door which connects the womb to the vagina, basically where the baby goes through. All right, we call it cervical os, okay, or the door to the womb. All right, so these are among the signs. And in terms of stages of labor, you have first stage, second stage, and also third stage. Okay, first stage means you are at zero dilatation up to 3 to 4 centimeter. Sorry, 10 centimeter. Second stage is when the baby is going to be delivered. All right, when the opening of the door is already 10 centimeter, you can actually push. Okay, this is the second stage of labor. So you push until the baby is delivered, and the third stage is actually the delivery of the placenta. These are among the stages. So at what stage can I get my pain relief and what type of pain relief? So you have the simplest one is Antanox, what we'll call as the laughing gas. Okay, so you can have that, but it doesn't really block the pain 100%, probably about 70–80%, and you feel a little bit lightheadedness, a little bit groggy if you have that laughing gas. All right, you feel a little bit sedated also. Number two is probably the injection. It's either Petidine or Nubin. It's a medication where we give you a jab. All right, this one also do not actually block the pain 100%, and it kind of make you a little bit nauseated and also sedated. And the ideal labor pain is what we call as epidural. Okay, so this is the pain relief where it actually, if it's done by a good anesthetist, all right, it will actually block the pain, but you're still able to lift your leg, you're still able to push. All right, it's just a block the contraction pain. So this is actually the ideal pain relief, okay, for labor. And usually the abuse doctor or the anesthetist doctor will perform this for mother who requested for this during the labor. All right. So roughly these are the things that you need to be aware of, your choices of pain relief. Yes, your husband can accompany in certain institutions, not all institutions, especially with the current pandemic. I know it's a bit challenging, okay, but most important thing is you have to be prepared. Your mindset need to be prepared from the beginning of the pregnancy. It's going to be a little bit challenging, but do not worry. There's a lot of web or information on the Instagram, on the Facebook to guide you actually how to go about your pregnancy. Okay, so we've gone through the stages of labor. Yeah, there's another question. How do you actually push? All right. Now, there's so many ways of pushing, but basically the aim is actually uh, to give a pressure as hard as you can along with the contraction pain. Okay, this is the best time for you to push actually. So with the contraction pain, you give an extra push so the baby will actually follow the path of labor to actually being delivered. All right. So of course, if you look around, there's a lot of technique, and usually in my labor suit, we just advise you the simplest one. All right, so you follow the instruction of the nurses and also the doctor. This is the time to push, so we'll ask you to push basically, especially if you are on epidural. You can't really feel the contraction pain, but you are able to feel something is coming out at your down around your perineum region or your private part. Okay, you feel very heavy down there, so we'll ask you to actually focus to push down around your private part. Take a deep breath when the contraction come and start to push, and we will actually help you to count. All right, 1 until about 10. So yeah, you push for at least 10 seconds as hard as you can, focusing on your on your private part where you feel the heaviness that would actually the head or the presenting part of the baby trying to come up. All right. Yeah, I did mention about pre-relief just now. Okay, so I would suggest if you have the opportunity, the best is actually still the how to say epidural. Of course, not everyone is privileged to have this opportunity to have epidural as pain relief, because there are certain conditions where it is actually contraindicated. For example, in patient having some spine problem or some clotting problem, so you might not be able to have this privilege having epidural as the pain release. Don't worry, you still have other methods, as I mentioned just now, either the laughing gas or the Anthenox, and also the injection. All right, so that's about it from the first trimester. I actually try to sum up everything, the common question that usually my patient ask. So until our next spontaneous trip, or remember this, all pregnancy, I would suggest to be planned. All right, don't make it spontaneous. Try to plan your pregnancy, especially if this pregnancy ended up with emergency or cesarean section. Okay, usually you need to space up your pregnancy at least for 2 years to ensure a good wound healing, especially on the cut of your womb. All right, if you had a cesarean section done for you. But if you have a normal delivery, it is still a good practice to space up your delivery for at least your pregnancy, I mean, for at least 2 years. Okay, there's a lot of method outside that should be covered in another chapter, I guess, regarding family planning or contraception. Okay, but whatever it is, yeah, you can have a spontaneous sexual intercourse or intimacy, but you need to plan your pregnancy. Okay, till then, I think that's all about tonight. Have a safe pregnancy journey, and of course, stay safe during this pandemic COVID-19. Thank you.
Okay. Thank you so much, Dr. Mai, for your insightful sharing. I will share my screen. Okay, so for those who just joined in, welcome to ZÉRA Talks February edition. So don't forget that we are also having a ZÉRA Carebox giveaway worth RM 350 to 2 lucky winners. So all you need to do is like and follow ZÉRA, Hakka Malaysia, and Moss Japan's Facebook and Instagram page, and fill up the Google form. And lastly, just share this webinar out. So please make sure that your post is public so we are able to view it. So in case if any of you missed it, just head over to our description box in our Facebook live video. The details are all pinned there. So also, if you're streaming this via Instagram live, please head over to our Facebook instead in order to participate in our Q&A session. The link can be found in our Instagram's page bio. So next up, we are honored to have Dr. Eliza as our next speaker of the night. She's an O&G consultant at Columbia Asia Hospital, Tebrau. Dr. Eliza also appeared in several talks and press, such as The Star and My Doctors on Astro. Her aim is to empower women through her special interest in cosmetic gynecology. Tonight, she will be talking about what they don't tell you in the postpartum period. Let us all welcome Dr. Eliza.
Okay, just give me a second. Okay. Hi everyone. Can you see me? Okay. So thank you to ZÉRA for the invitation of giving a talk tonight, and I'm glad that all of you could actually join us on a weekend to actually hear us talk about the antenatal and postpartum. So thank you, Dr. Mai, for the wonderful talk just now. So I hope it actually opened up your mind and your thoughts about pregnancy. And what I'm going to talk about today is actually what they don't tell you in the postpartum. So whoever has listened to my talk previously, they would know that I'm actually quite honest with telling patients about management and telling patients what to expect And I always tell my patients, sometimes you can't have expectations. You have to understand that some things don't go as planned. So you always have to have a plan B, and you need to understand your pregnancy and your outcome after that as well. So let's go on to the top. Give me a second. Okay, so postpartum, what they don't tell you, because a lot of things that people share online or on social media or what the doctors tell you are the things that you want to hear sometimes, and you see the nice things as well, but you need to be prepared to face the postpartum, because a lot of patients out there, they only prepare for antenatal, they prepare for the delivery, but then they forget about the postnatal, they forget about the postpartum. All they think about is their baby. They don't think about themselves as well. So I think we need to prepare for the postpartum because it's equally important as well. So this is, some people call it the 4th trimester or the postpartum. Congratulations, you've actually successfully pushed the baby out of yourself. You're feeling all excited. You plan to start a brand new journey, and you actually feel relieved that the journey is, you thought it was over, but it actually isn't. Okay, so some of my patients, they tell me in the 3rd trimester, they tell me that, doctor, why can't I sleep now in the 3rd trimester? I have trouble sleeping, the baby kicks all at night. And I tell them honestly that you won't be able to sleep after this at all. You wait till the postpartum actually happens, and you realize that you can't sleep until your children actually goes to university. So this is some of the things that you need to understand. What happens in the first 24 hours after giving birth? There'll be physical changes, there'll be mental changes as well. You might experience bleeding from the vagina, and we address this as lochia, and it will feel sore. Your breast will start producing a bit of fluid or colostrum. You will still feel cramps in your belly or your uterus, because a lot of patients after delivery, they ask me, doctor, why is my tummy or my belly still painful? Why do I have this cramping pain? Is there something wrong? And if you go for a cesarean section, you will feel sore in your abdomen area, and you feel sore at your Caesar scar as well. And you will have problems passing urine. And a lot of patients ask me, why, doctor? Why is it the first time I go to the toilet, it's always, it's a stinging sensation. I have problems peeing. So these are the things you need to understand, you need to expect as well. Okay, and you will actually experience changes in your hormonal levels. You feel excited, you feel scared at the same time, you feel happy, but you also feel confused. And of course, I always tell them, going through birth is actually like going through a marathon. It's like running a marathon. You will feel exhausted after that, okay? So you should know that it's not easy. The postpartum is not something that, that you can do alone. You need help. You need help from your partner. You need help from your caretakers. You need help from your family. You need to take care of an episiotomy wound. If you have a wound down there, you need to know about the lochia, because some patients don't actually know that you tend to bleed for actually 6 weeks. Okay, and you might feel you might have hormonal changes, you'll have baby blues or postpartum depression. You will still have your constipation, okay, and hemorrhoids. You will have tons of breast problem, okay, we'll go into that in detail later. You'll have diastasis recti, which is actually, if you look at your belly will actually give way. This is because of 9 months of pregnancy, your belly has actually expanded, and the muscle has actually thinned out and is given way. So you realize that even though you're thin, when you cough, there's a bulge in your belly, and you have to prevent this from happening during pregnancy itself. And you'll still have uterine problems. That means your uterus still needs to shrink back, and you will have pain when this happens. So the 8 things that I need to tell the mother, the first thing is your body will change. You're not going to have your body again like pre-pregnancy. You have to understand that, and you have to accept it. There are going to be some changes, but it doesn't mean that you can't take care of yourself. Your breast will actually swell up and hurt, and some of you may not even have milk. So you have to understand, because I know a lot of people out there, they have plans that I want to fully breastfeed my child. I'm going to breastfeed for 2 years, but sometimes you get frustrated that you have no milk at all. You still need your checkups after delivery, because a lot of patients, they think that, after I've delivered, I don't have to see the doctor anymore and it's all done. Okay, you will continue to bleed. So you need to know what's normal and what's not. The other thing is, you may wonder, why am I so emotional? Why am I sad all the time? Then you realize that 6 weeks isn't enough for postpartum. Okay, and when you go back to work, people will tell you, oh, you had a good time relaxing at home, and you realize, no, it was not a relaxing moment at all. And people will always come by to your house when you're not ready because people want to come visit. And of course, having a baby is not easy on the relationship as well, okay? It will put a strain on your relationship with your partner, with your parents, with your family, with your siblings. As for the baby, you have to understand that because I have friends or patients who ask me, why does my baby look like that? And you're wondering that, why come, I thought all babies are supposed to be cute. To me, all babies are cute, but it's your perception. So not all babies are born cute to your eye. Because the thing is, you have to understand that babies, when they're immediately born, if you go for a vacuum, or the baby may look swollen and stuff like that, covered in blood. So they may look different. Give it a few days, okay? And then you may wonder as well, why isn't my baby sleeping? Is this normal? And patients or mothers always come to the emergency department bringing the baby. My baby cries all the time. I don't know. Every baby is different. It may be your 4th pregnancy, it may be your 5th pregnancy, but you have to understand that every child is different as well. And of course, babies get sick too, because the thing is, you're planning to have this wonderful postpartum time, you're in your confinement center, but you never thought, what if my baby gets sick? Have I prepared myself for that? What do I have to do? So the body changes. Immediately after you give birth, you lose up to 5 kilograms. This can be from your baby, placenta, and the fluid that you have in your tummy, in your uterus. And after a few days, the fluid retention that you've been accumulating will drop further. You have this birth plan in your head, and you imagine yourself breastfeeding the baby soundly immediately after birth, music playing in the background, maybe Mozart, anything like that. But trust me, delivery is not easy. It's really tiring. You'll feel exhausted. You feel like you just fell off a building or run a marathon. Your whole body will ache. And sometimes when we show you the baby also, you're too exhausted to even look at the baby. And we ask you to breastfeed, and say, no, please, I want to do it later. Some patients are like that because maybe you've gone through 12 hours of labor or 14 hours of labor. We don't know. Okay, so everything is different. So don't have that kind of expectation that you imagine in your head. You might also be drowsy from the analgesia that they've given you, because sometimes you've opted for the gas, or you've opted for the injection with it, inject your thigh and things like that. So you might be a bit drowsy from that as well. And when you actually deliver, you may have passed urine, or actually pee in your pants, or actually pee down there, or actually just soiled yourself as well. So it may be a bit uncomfortable for you as well. The next thing is you have to understand that your belly won't shrink immediately. After delivery, you have to understand that your uterus will take time to shrink. Immediately after birth, normally the uterus will be at your belly button. Okay, if you look at the picture there, it'll be at the belly button, and it will still be sore because you're going to ask the doctor, why do I have cramps? Why do I feel like I'm having my periods or my menses? That is a good thing because your uterus is actually trying to shrink, and this will prevent bleeding. And it takes about 2 weeks to shrink back, so that you can't feel it anymore. So if you actually feel your belly after delivery, you can actually feel it's still hard there. There's actually a uterus there. And then of course, you'll have excess skin in the belly, because a lot of patients ask, doctor, why is my skin like this? When you were pregnant 9 months, everything was shiny and tight. You did not see it coming. After that, suddenly all baby comes out, the fluid comes out, the placenta comes out, you're left with hanging skin there. So you have to understand, and you have to accept that will happen. And it is because of 9 months of stretching, okay? And of course, not only your skin stretches, but your muscles, your abdominal muscles, if you actually don't work your core during your pregnancy or prior to pregnancy, you will have weak abdominal muscles. And this will be thinned out, and this will make you have a very weak core. And you realize that your skin will actually be darkened, and it will be very dry after delivery. So after your baby's out, you might compare your hand to your belly, and you realize that, doctor, why is my belly darker than my hand? Well, previously you didn't realize it, but your belly was darker because of hormones, but because it was actually expanding and it was actually big, so you didn't see that your belly was actually dark. When it actually comes small and shrivels up, then you realize how dark it was. And this can be a bit of a problem for some mothers. They get really sad and emotional when they're looking at their belly. Okay, so this is some of the pictures that you have to expect to see, because can you imagine, it's like a pool. Look at the picture there. We're not trying to scare you and anything like that, but we're trying to tell you that these things are normal, and you have to accept these things that happen to your body. So you'll have your stretch marks initially. Some of the patients are lucky not to have any, but if you have some, they initially will be a bit dark, then they lighten up with time. They don't immediately go away, and you can see that you have that line in the center. It will be there. It will take a few months to lighten up. You have to understand that. And you can see the shriveled skin is because of the expanding, because of the 9 months you went through expansion of your belly, so it has shriveled up and it has become like that. Okay, and it will be very dry as well. So you need to take care of yourself, wear lotion, wear a binder to actually look after yourself. What do I need to do to accept all these body changes? First of all, you need to applaud yourself for going through labor and going through pregnancy for 9 months. You have to accept that there is going to be physical change to your body. Most importantly, don't quit looking after your body. You have to look after your core. That's the most important thing I tell my patients, because the core is attached to the perineum muscles, and this is very important so that you don't have problems later on in the future. You don't want to end up sneezing and passing urine, isn't it? And coughing and passing urine. So you really need to work on your muscles. Okay, so what you can do is you can do some exercise. There's so many websites out there to teach you about postpartum exercise, and you need to find a good binder, because evidence has shown that binders are actually good to strengthen your core. Get the one from the chest, lower just below your breast until your hip level. Okay, and of course, good eating habits. And if you're on supplements, continue taking your supplements, because a lot of patients actually stop taking supplements when they have delivered. They only thought that, okay, the supplements are good enough for my baby, that's it. But you actually need supplements for yourself, including calcium, because you're going to breastfeed, you're going to bleed, so you still need your vitamins and supplements as well. And of course, for your skin, because there are still hormones lingering in your body. Relaxing hormones, for instance, can stay up to 6 months, so you need to moisturize your body and be patient with the skin changes, because it does take time for it to actually slow down and get better. What about your breasts? So a lot of people are asking, a lot of patients, they're asking the doctor, why don't I have breast milk? Well, everybody's different. You have to understand that. Not everybody will have milk in the first instance. There are some patients who have milk earlier on before labor itself. There are some patients who have it much, much later, 5 days later. Everybody is different. Don't pressure yourself thinking that you're not a good mother. Don't compare yourself to other people as well. Some of your mother-in-law, your mother might tell you, no, how come you don't have breast milk? You're not pressing enough. You're not actually squeezing in it. You're not encouraging it. You have to give the baby. They're going to tell that to you, but we know that you're trying your best, and it's really frustrating, but everybody's different. What you need to do is just stimulate. Not everybody will have breast milk in the beginning, okay? But start feeding early as possible to actually encourage breast milk to come out. Not all nipples are the same as well. So before you actually go into labor or actually reach the postpartum, make sure you have a look at your nipples, okay? Some nipples are inverted. That means it actually goes in. So there's a problem for the baby to actually suck it. So if you're not sure, you can just ask your doctor or your midwife to have a look at your nipples to make sure they're okay, okay? And not all babies latch easily, because you might be struggling and asking, why doesn't my baby latch? And this can be really troublesome for you. Get the nurses to help you, get the midwives to help you with that as well, because even though it's your 4th baby or 5th baby, every baby latch differently as well. You have to remember that your breasts not only have milk, but they can actually cause a nightmare, and they end up with mastitis or abscess, where if it's too full and you don't pump your breast and it's really engorged, you may end up with an infection, and sometimes it gets really bad, you may end up with surgery as well. Okay, so this is a picture of mastitis, the one picture up there, and the one down there, there's already a pus inside. So for the second one, the second one, you might need to go for surgery. So these are the things that you need to look out for. And a lot of patients, they actually say that breast abscess and mastitis is even painful than labor. So you have to get ready about to manage your breast as well. And a lot of patients, they don't realize that you'll have cracked nipples. Everybody will have cracked nipples when you breastfeed, okay? So make sure you have the right cream, the right ointment for your cracked nipples, and they're all safe in breastfeeding. So don't be scared about trying all the nipple cream and the cracked nipple cream as well, okay? You still need a postpartum checkup. Please go visit your doctor. postpartum as scheduled. Go earlier if there are any problems. The frequency of the checkup will depend on whether you had a cesarean section or a vaginal delivery. If it's a cesarean section, the doctor might see you a bit earlier compared to vaginal delivery. Or if you had a vaginal delivery, or maybe a complicated one, or maybe an instrumental delivery, such as a vacuum or a forceps, they want to see you earlier. So what can happen postpartum? Why is it important to see a doctor? You need to understand that a lot of things can happen postpartum. You're not out of the woods yet, okay? So the postpartum is very important. You may end up with blood clots in your legs. You know, if you go for a cesarean section, the doctor may give you an injection to inject yourself at home for a week or 10 days. This is to prevent the blood clots from happening. And a lot of patients don't want to do this, but you have to understand that it's very dangerous. So what the doctor needs to check during the follow-up is they want to see your legs, whether you've got any swelling, any blood clots in your legs. They want to see your breast if you get any infection. They want to see the wound, whether it's a Caesar wound or a vaginal episiotomy wound, to see if there's any wound breakdown or infection. They want to look at your uterus to see if there's any infection going on inside as well, because some patients do have a higher risk to get infections, such as patients who are leaking. That means their water broke earlier on, or patients who had fever when they went for delivery. Okay, so they need to monitor all this. And of course, some patients, they have blood pressure problems where the blood pressure actually goes up. So the doctor needs to monitor this. And you can't do this at home by yourself. Or the confinement lady can't do this for you as well. You need to go for your checkup. The next question I have is, why am I still bleeding? A lot of ladies out there don't know that you actually bleed for 6 weeks. Some patients may be a bit shorter. Some patients can go more than 6 weeks, but you need to know that it's roughly around that. And for cesarean sections, the flow might be a bit lighter. The color will darken with time. So what is not normal? Not normal is because you have to understand that as the day advances, your periods or your lochia will actually get lighter, but they'll get darker in color, meaning that it will get less, you will require less pads, but then the color from bright red, it's going to be a bit maroonish, and then the end is going to be a bit yellow. Okay, so when is it not normal? You have to know when suddenly at home, maybe it's in your day 6 or day 7 or day 10, suddenly you have a gush of bright red bleeding. When before you only had maybe a dark brown, for instance. So there is change in the blood, and suddenly you have clots, a lot of clots. We're talking about after 1 week, so something different in your flow, okay? And when there's something unusual coming out, or when it's really smelly, or it has an offensive smell. So these are the things that you need to look out for, and these are things that you need to tell your doctor, okay? And when there is pus discharge, okay? So lochia, what's normal, what's not? First 4 days, usually it's bright or dark red. It's a bit heavy, like your periods, okay? You maybe have small clots as well. And from day 4 to day 10, it gets a bit lighter. There's a lot more discharge though. Fewer clots, and it's going to be brown or pink. And day 10, 28, usually it's going to be white, yellow discharge. And sometimes a lot of patients actually finish off earlier, okay? So you bleed because that's where your placenta actually separates from. So it's your uterus is actually shrinking, and when you shrink, it actually bleeds as well, okay? The next thing is, which is very important, which I think all of you need to understand, in the postpartum, you will have emotional instability. So the question is that you will always ask, doctor, why am I sad all the time? The smallest things actually hurt your feelings, okay? So that's why I think it's very important out there. I always tell my patients, I always ask them, how are you planning your confinement? So are you going to go to a confinement center? Is there anybody taking care of you? Are your parents around? Will your husband be there? Because this is all important, because you should not go to a place where you're not comfortable with. I think this is very important, and you should discuss this with your partner, because sometimes a lot of couples out there, they're scared to discuss things with their partners. They want to make everybody happy. So you're the mother, you want to make your husband happy, and your husband says, okay, let's have confinement at my mom's house or your mother-in-law's house. But you need to be comfortable, because you're very emotional at that point. So you need to discuss with your husband. And husbands out there, you need to understand that you need to actually support your wife's decision at this time, because she's the one that's going through all this emotional state, okay? And she's going to be sad. So why do you feel sad? Because of your hormonal changes, and this will cause mood instability. But sometimes certain medication also causes you to have some emotional problem as well, such as your antihypertensive. We have a few definitions of being sad. First of all, which is quite common, is your postpartum blue or your mood swings. You'll have crying spells. You realize that you feel a bit anxious and you'll have problems sleeping. And this usually appears 2 to 3 days post-delivery, and it can go on up to 2 weeks, okay? But sometimes it gets really severe, what we call postpartum depression, and your partners or your family need to look out for this, because this is when you need to seek help. When you have excessive crying, okay, and you realize that there's difficulty to bond with the baby, you look at your baby and you get angry. This is where you read in the papers that, you know, the mother actually throws the babies away, they actually go out of the house, just leave the baby alone. This is actually postpartum depression. They have no control over it, okay? It can be due to you have this overwhelming fatigue, loss of energy, you're really irritable and you're angry all the time, you feel hopeless, and you're unable to think straight, you have panic attacks where you can't breathe properly, and you also have suicidal thoughts as well. Okay, so this is very important. Your partner, your family needs to identify this and seek help, because you as a patient, you wouldn't know. So you need to talk about this with your partner as well, so they are aware about the changes that you face. What about postpartum psychosis? There is such a thing where you have confusion and disorientation. You have obsessive thoughts about your baby. You have hallucinations and delusions. That means you see things, you hear things. That's when you actually hear things telling you, or harm your baby, or do something bad to your baby, or somebody's trying to steal your baby. So a lot of people actually say this is like, you know, buatan orang or things like that, and they're going to go and bring you to a traditional healer and stuff like that. But this is actually postpartum psychosis, and it's really real, and it can be really harmful to you, the people around you, and your baby. So if you have any of this, please seek medical attention. When to see a doctor when you have all these symptoms? If it doesn't fade after 2 weeks, if you realize it's getting worse, you have no control over it, you find it really difficult to care for your baby, and you find it difficult to do your daily tasks, you have harming thoughts, harming yourself, harming your baby, or anybody in your family, and of course, if you have suicidal thoughts. There are risk factors. If you have history of depression, so your partner needs to understand that you have a high risk of getting postpartum depression. You have bipolar disorder, you have family history or family members with depression, you've had a stressful event in your life, maybe a spouse passed on, or a mother or a father, your baby has problems, or you have a special need baby, you've had multiple pregnancy, you have problems with breastfeeding, you have relationship problems, you have a weak support system, financial problems, any problem in your life can actually trigger this event. And if this is an unplanned unwanted pregnancy, okay? So after your confinement is done, you realize that 6 weeks isn't enough, because you realize that you barely had enough sleep. You've not got your body back in shape. You're still frumpy. You're still, you're losing hair. You realize that you're going to lose hair when you breastfeed and after you deliver. You're still not sleeping right. You have dark circles. Your body is still sore and painful all the time, and you realize that you actually still look pregnant, and this is really sad for some mothers. But if you need to get control of yourself. You need to plan. That's why it's not just planning the 6 weeks. You need to plan for 3 months what you're going to do after this, and you need to plan early on regarding childcare and baby care, because that will give you a headache. So I would tell my patients, you need to plan earlier on when you're pregnant, where you're going to have your confinement, who's going to take care of your baby, what is plan B if you can't send to a nursery, for instance, like MCO right now, what you're going to do, things like that. You really need to discuss this with your family members. The other thing that is a bit funny, but I think it always happens, people always want to come by and see you. So they want to come and see you when you're actually at home and you're never ready. You're in your confinement and you're really tired. You actually really don't want guests, but they want to come visit your families and stuff. And you realize that you'll be half naked all the time. You'll be breastfeeding your baby. There is dirty laundry everywhere. You smell of milk. There's baby poo everywhere. Okay, but the good thing is we're in the, well, I mean, the other thing is, it's not a good thing, but during the pandemic now, so you have an excuse not to let visitors come over. Remember, don't let them touch or kiss your baby or touch you as well, okay? Because you're still in the confinement period, you're still not fully recovered, you're still not well. So please, no such thing as akikah, majlis akikah, you know, all that kanduri and stuff. No such thing as letting people, even though it's your grandma, your grand auntie, snuggle up to your baby and, you know, kiss, mother or baby all over. Because if your baby gets sick, you're the one who's going to go to the hospital and wait for your baby. Okay, so you have to understand that people do want to come over. So just mentally prepare yourself for that as well. This is very important because when you have a baby, it will put a strain on your relationship. You have to understand, accept that. So I think every patient out there need to discuss this with their partner, with their family members, with their mother-in-law, with everyone. But talk to your partner first, okay? Plan your confinement, what you think is best for you physically and mentally, because sometimes I have patients who go to the in-laws house, they don't have an attached toilet, they're sleeping, they don't have a comfortable room, they don't have an air-conditioned room, for instance, and you know that your house, you have an air-conditioned room, and that's what you want, because when you're in your postpartum, you realize that you sweat a lot. And it's hard for you to go to the toilet is far. So these are the things that you need to understand. And you don't want to end up fighting with your spouse about all these problems. So you need to sit down and plan what is the best for you. Okay, choose a place where you are comfortable. If you're not even comfortable at your mother's house, don't go. Okay, stay at your house if you're comfortable. Get help. Okay, because I think it's very important to get help in the postpartum. What about fads and pantang? Am I allowed to do this? Am I allowed to eat this? Am I allowed? Are there things that I should do or shouldn't do? Well, I think pantangs for pantangs every race it's something different. To me, if a patient asks me, should I follow? To me, you don't want to get anybody angry. You know, you don't want to fight with your mom. Just follow the things that you think is okay. But what you think is not okay for your body, just don't do it. What not to follow is water restriction, because I know some pantangs say you can't drink water because it'll get you wet and soggy. That is not true. You'll end up with blood clots in your brain, in your vessels, and also please drink lots of water. Some people say you must bind yourself, you know, like bengkung is good, but you must bind yourself and not move. No, you must move and exercise. You must move around and shake your legs and body and do some workout. Okay. They say that you must take only rice and ikan bilis, no chicken, no eggs, no seafood. I tell my patient because they said it will actually make your scar itch. But I tell my patient, they tell that to everyone because it's easy, because you don't want to see what you're allergic to. But to me, eggs, chicken, they have a lot of protein. You need it for recovery. So take it in moderation, take it enough because you need a lot of protein to recover. But if you think that it causes some discomfort, then stop. But don't ban everything, okay? You can't just be eating rice and plain rice and ikan bilis. You have to have your vegetables, you have to have your chicken, you have to have your protein, okay? Some pantang say must only drink herbal water, cannot drink plain water. No, you must drink lots of plain water to cool yourself down, and must only bathe in herbal water. Not necessarily, because in herbal water, some herbal water, they actually cause itchiness, and I have patients coming with some sensitive reaction to at the scar site on your skin because of this herbal water as well. So you want to adapt and see. So you can follow the pantang, but don't follow the thing that is actually not good for your body. That's it. Can I actually do sauna and steam? Yes, you can, no harm, okay? But always ask your doctor first, okay? So these are some of the pantang that we know. Malays have different pantang, Chinese have different, Indian has different, but basically they just want to take care of your body as well. Don't fight with your mother-in-law or your mother regarding pantang. Just listen, you know, respect their thoughts and stuff like that. But you know, you don't have to follow everything. Just follow parts of it that you think you can follow. If they say that cannot drink ice water, for instance, you don't drink ice water. I don't think there's any harm not drinking it. So if you can not drink it, don't drink it. You know, you don't want to cause a fight or riot in the house. Okay. About babies. So a lot of patients ask, why does my baby look like that? So when you deliver, you have to understand that the babies are, when they come out, they're not actually very clean. They have blood, they have vernix. So don't be surprised when you look at a baby. And babies, sometimes they have swelling, they have edema. The head shape may actually be a bit funny because they follow the pelvis, and sometimes they may be a caput because of or a swelling because of vacuum, for instance. So it will subside. So don't worry if your baby's head looks a bit off, okay, or your baby looks a bit blue. There might be a bit of bruises. Babies heal very well, and the appearance actually change very fast. You realize that, okay? And babies actually sleeping patterns are erratic. They'll breastfeed on demand, and sometimes every half an hour. You have to understand that. And they only drink little, and then you put them back, and they come, and then they poo, and then you have to change, and then they feed again. So you won't get any sleep. You'll be tired all the time. So you need some help, okay? And actually, babies poo a lot. So you need to ask your pediatrician what's normal. When you're breastfeeding, it's going to be different. When you're actually bottle feeding or giving formula, it's going to be different. So you need to inquire with your pediatrician to ask what is normal for your baby. Okay, and it's actually normal for baby to wake up all the time. Babies cry all the time, and sometimes patients, they bring the babies and, doctor, why is my baby crying? Well, I don't know actually, because there's so many reasons. You'll get used to it. There can be colic, a baby might cry when the baby's passing motion, or hungry, or when the baby's hot as well. So it's quite normal to be frustrated during the first few days or the first few weeks, but you'll get the hang of it. Then you realize why this baby is crying, but sometimes you just don't know why, and this is quite normal as well, okay? And you're wondering, it's my third child. My first and second was the same. Why is my third one different? Every baby has a different sleeping pattern and crying pattern. No difference between boy and girl. Some babies latch better, some don't. And don't compare your babies, even though it's your third or fourth or fifth child, and you know that you've got the hang of this. I know this, I've done this 4 times already, but this one may be different. So accept that your pregnancy and your child is different, and they're not the same, okay? The most important thing when you plan for postpartum, you have to understand that babies get sick too, because you're planning your postpartum, you're going to go back to your hometown, you're going to go to a confinement center, but have you ever thought, what if my baby can't be discharged? So you have to think about that. What if my baby is admitted to the NICU or the nursery? What if my baby is jaundiced? What is my plan? So whenever, for parents out there, whenever you've gone through pregnancy, you've gone through the delivery part, you have to think, is my baby going to be okay? Is my baby going to be discharged? And then on day 3, you realize that your baby's jaundice, your babies need to be admitted. What's going to happen to you? So you have to have a plan. For instance, if you're staying in a confinement, a place with at your mom's or a confinement center, if my baby gets admitted, am I going to be admitted with my baby as well so that I can breastfeed? So these are the things that you need to think about. Not all babies are discharged with the mother. Some maybe are staying long in the ward, they have fever, some maybe have hypoglycemia because you have diabetes, for instance. Some babies may be premature. Some babies may get jaundice. So, you need to actually think and plan ahead. And avoid giving your babies rubbish because you only give milk, please, because a lot of patients out there, I had a patient who actually, baby was admitted after that because the mother actually gave baby goat's milk because the baby was jaundiced, and the mother listened to the family members, and they said that this goat milk is actually going to make your baby better. And they actually gave raw goat milk, which is not pasteurized at all. And the baby got sick with sepsis and was admitted to the ward. So please don't give anything else to your baby. Water, tea to prevent jaundice, that's all rubbish, okay? Okay, I think that's all about my talk. So I think the most important thing is for mothers out there, stop trying to calm the storm. Calm yourself, because embrace postpartum. It's not easy, but if you plan and you understand and you accept what's going to happen, the storm will pass. Okay, thank you so much.
Thank you, Dr. Eliza, for your interesting sharing. So I'll be sharing my screen again. Okay, so we will move on to our Q&A session. So the first question would be for Dr. Mai. So hi, doctor, when is the correct time to do detailed scan?
Hi, Gail. So detailed scan, we need to understand how many scans do a woman need to go throughout the pregnancy. Okay, if you remember, in the first trimester, it's very important to have a dating scan or an early scan to determine your estimated date of delivery. All right, so second trimester is the question just now. Okay, detailed scan or anatomy scan, or a scan where a specialized trained sonographer or fetal-maternal specialist will perform the scan somewhere around as early as 18 weeks up to the latest of 28 weeks. All right, it should be done around that. It shouldn't go earlier than 18 weeks or later than 28 weeks, because beyond 28 weeks, the baby is already big enough. You can't actually see every single structure. All right, so the best timing is around 18 to about 22 weeks. Okay, if you miss that point of time, probably up to 26, 27 is still, we are still able to do it, but beyond 28 weeks, yeah, you can't do it. So the best is somewhere around 18 to 22 weeks, okay?
Okay, thank you, Dr. Mai. So next one is for Dr. Eliza. Today is my 26th day after delivery. I'm not hating my baby, but I frequently feel sad and I feel like I'm not good enough. This is my first baby. Is it normal?
Like I said before, the symptoms, the normal postpartum blues should be for 2 weeks. Okay, so if it's gone beyond 2 weeks, because you said this is your day 26, I think you need to actually go see a doctor and get help. Okay, because sometimes you may have other things in your life that you have problems with and you need help. That means sometimes the doctor needs to assess you, they'll refer you to a psychiatrist, maybe you need to start a medication, and your family members need to know as well. So my advice would be go see your obstetrician if you can't see a psychiatrist straight away and get help. So she or he will refer you to the doctor who's going to actually assess you properly, your mental state, to see if you actually need some medication or help.
Okay, thank you, doctor. So next one is for Dr. Mai. I have no appetite during my pregnancy. I try to eat more, but I always feel full. I'm afraid that my baby is not getting enough nutrition.
All right, this is interesting. Okay, so I think the misconception here is I need to eat a lot because I need to eat for two. All right, so in pregnancy, it doesn't go like that. Okay, whatever you eat, the baby is like a very, how to say, super parasite. It will absorb everything that you eat, actually, all the nutrient. So if you have trouble eating, especially in the first trimester, yeah, I do understand, especially, the smells, you can't tolerate the smell, feel nauseated. Certain food can actually trigger you to vomit, oily food. So you try to avoid those spicy, oily, those with a lot of what we call as a gravy or santan, try to avoid that. Try to take lighter food, like some porridge, plain porridge. Okay, you add a little bit of protein like chicken, and don't forget your fruits and also vegetables. Okay, so you try to change a little bit in the first trimester, especially your diet. All right, try to avoid those food that can trigger you to vomit. All right, you take a small but frequent diet, regardless of, maybe some people need 5 times a day, 6 times a day, but all are in a small but frequent diet. This is again to avoid those triggering moment where you feel like, vomiting when you eat a lot. All right, so you need to understand in pregnancy, your, how to say, your body, especially around your stomach region, or where we call that area as the, how to say, there's a sphincter actually, which can be loosened during pregnancy because of the pregnancy hormonal changes. So this can actually trigger you to feel, when you eat a little bit, it feels like vomiting. You feel like regurgitating back the food. All right, so you need to be able to choose your food. You try to explore. All right, this is the time actually to explore. Don't be afraid. A lot of, especially Malay, they're scared to take buah mata kucing, pineapples and eye kelapa. They say all this can actually cause a miscarriage. Okay, it is not actually, as long as you take in moderation, not excessive. All right, and don't forget, you can take durian. Actually, it's actually quite safe, but don't take too much. All right, just one, how to say, one not what do you call that? Satu ulas, basically. Okay, one or two at least, per serving or per day. Don't take it beyond 3 ulas, because that can actually cause your sugar to goes up during pregnancy, and you don't want to have diabetes in pregnancy, right?
Okay, thank you. So next one for Dr. Eliza. Is it true that after second delivery, it will be more difficult to get back in shape?
No, it's not true at all. There's no such thing as first delivery, second delivery is going to be difficult, because I know some patients actually, they accept the fact that, oh, it's normal to be like this because I've had children before. I think it's, you have to let go of that misconception. First of all, during the pregnancy itself, like Dr. Mai said just now, you have to, your weight gain should be proper, your diet should be proper in the antenatal. You start off antenatal. So don't think it's okay, I'm going to eat everything postnatal or antenatal and then shut it off postnatal, because it's not that easy. It's true that as we age, our metabolism is going to be a bit slower down. It is true, but that doesn't mean that it's because of pregnancy that it's harder to shed off weight. Okay, so if you follow a normal exercise and you actually have calorie counts, and you actually work out, you can actually lose your weight. It's not because of your first child, second child, third child, because a lot of patients out there, they have 5 children and they are still fit, they're still running marathons. You have to think about that. So I think that's just an excuse. Okay, so it's just in the mindset, so we can change that.
Yeah, look at Dr. Eliza. After how many children? Still look,
Two, but then
slender.
So next one will be about body as well. So this one is about Dr. Mai. So my weight is static before pregnancy, and currently I'm in my second trimester. My weight is the same. Is it okay if I'm not gaining weight?
All right. Yeah, we do care about the weight in pregnancy. Basically, if you lose too much, also it's a scary thing for us, or if you don't gain at all. But it's all go back to your preliminary weight prior to pregnancy. Basically, for example, if you're already like 80 kg prior to pregnancy, and then you gain maybe 1 or 2 kg in pregnancy, as long as the baby is growing, all right, so it should be okay. Okay, if you notice, some like my patient, basically in the first trimester, there is a patient where she started off with 100 kg, and she lose 7 kg just in the first and early second trimester. Just imagine, okay, because she can't actually tolerate a lot of things. All right, and later on, after towards the end of second trimester and the third trimester, she kind of catch up. She gained not that much, okay, 2 or 3 kilo, which is good for her because it's just enough to actually reflect that the baby is actually growing. All right, so do not worry if you don't really gain that much in the first and second trimester. Usually you will gain at least few kgs in the last second trimester and the third trimester. All right, so do not worry, as long as you're eating well, you're taking all the supplements that your obstetrician has been giving you. All right, and every time you go for follow-up, the doctor will actually assess the baby growth, and by clinical examination and also by scan, and it shows that the baby is growing well, then it should be okay, right?
All right, so next one, Dr. Eliza. Why can't we give plain water to baby?
Okay, babies, you can't give it because there's no nutrient in plain water. Okay, so babies actually, because you're going to just make them full, but there's no nutrients, so there's no benefit of giving plain water. And you basically want to feed the baby so that the baby is full, because that's the only nutrient they get. So you want to give only milk, nothing else, because the bowels of the baby, the digestion system of the baby can only take that. Okay, so I know some of our culture, they want to start off early by giving some tea, because I've heard patients say it reduces jaundice, water will dilute the jaundice. All that is not true, okay? So you can't give plain water, you can't give any, when they're baby, you can't give any juices yet, all you have to do is milk, okay? So the baby's digestive system is not built for anything else at this point.
Right, so next one, Dr. Mai. What kind of abnormalities can we detect during detailed scan besides baby physical's body?
Okay, basically in detail scan, So we have, I think, two broad category. One is to detect the structural anomaly, which is very clear, from head to toe, whether the baby is having sufficient 5 fingers or maybe lacking one, the eye, the nose, the mouth. You can see that this is structure, all right? And on top of that, apart from the structural problem, where the baby can have some heart defect, spine problem, absent of both leg, there are certain syndrome. We also spot what we call as soft markers. Okay, these soft markers actually reflecting high probability that the baby is going to have some syndromic condition like Down syndrome, Patau and Edwards syndrome. These are the most common three chromosomal problem that we usually see, all right, especially in the fetal-maternal clinic. Okay, so like in Down syndrome, they have specific soft markers where the sonographer or the fetal-maternal specialist can pick up all these markers and with high probability that the baby might have this problem. Okay, so that's why Down syndrome can actually be detected very early. All right from the even the as early as early second trimester and towards the trimester you can detect actually, especially during the detailed scan, and some in the first trimester when they do another special scan that we call as NT scan or knuckle translucency scan, where you actually try to see the thickness behind the baby neck. All right, so there are certain parameters and you match with the mother's age and also some blood markers. All right, this can actually also help to predict whether the baby is going to have some syndromic condition.
Okay, thank you. So next one is for Dr. Eliza. Is there any ointment that can be used or recommended to heal episiotomy wound?
Oh, I have a lot of this question actually, so I can't actually say what you can or what specific brand there is, because there's a lot of patients asking for any wound, any scar. So um, whatever it is, first of all, when you have an episiotomy scar or Caesar scar, you have to keep it dry first. So if you can't wear any, for episiotomy scar specific, you can't wear any cream while you're actually still having lochia, because it's still dirty and you're still having your flow and you might have a lot of discharge. The normal wounds for the cream for wounds are the ones that you can get at your pharmacy for wound healing to reduce scar. That's the only thing. But there's nothing that can actually make it disappear or make it better in that sense. Okay, so there's no specific brand. There is no specific kind of oil or anything like that, but it depends on what your body responds to. So I can't actually point out if there's any specific thing that you can actually make the scar better, because it depends on your individual body as well. But whatever it is, if you want to wear it, you have to make sure that it is actually clean, because you have to understand when you're wearing something down there, you have discharge, you have blood coming out, it is not really a hygienic area for you to be mixing with creams. Okay?
Okay, so next one for Dr. Mai. I have scoliosis. Is it okay if I opt for epidural?
Yes, this is among the other, how to say, either it can be a contraindication or relative contraindication. Most of the time when the patient is having scoliosis, if it's at the upper part of the, what we call the spine, all right, the vertebrae, okay, most of the time at the lumbar region, you have a certain region where you need to give the epidural, okay, usually it's between L3, L4, right? So at the lumbar region. So if that area is okay, yeah, some anesthetist or the abuse doctor can actually give you epidural. But most of my patient with scoliosis, yeah, my anesthetic colleague, they actually quite reluctant to give, because of the risk of the side effect or complication.
Right, so next one for Dr. Eliza. What do you think about treating newborn jaundice using homeopathy?
Okay, okay, homeopathists out there might hate me lah, but I don't believe at all. So when you have jaundice, you're not supposed to treat with anything else, because you have to follow evidence base. I'm a doctor, so I don't believe in homeopathy. So if you have a baby with jaundice, see a pediatrician, treat. They either they're going to give you the blue light, or if, because we have patients who've been taking homeopathy medicine and they end up with exchange transfusion, where you actually have to change the blood of the baby, and we don't want it to go to that extent. So please, 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 before you start anything, first of all, go ask your doctor first, seek medical advice. Okay, don't go simply listen to other people buying things over the counter or listening to your cousin's relative, whatever, and buying homeopathy. Okay, it doesn't work. It'll make your baby worse.
Okay, so next one for Dr. Mai. Is it true stress delivery can affect development of the baby?
Stress delivery, what does that mean? Stressful, is it? Stressful environment?
Yeah,
Yeah,
should be
probably. Yeah.
stressful environment.
I assume, yeah, probably that. Stressful. Now, how to say, if you go for a normal vaginal birth, it is actually a form of so-called a little bit stress for the baby, because the baby need to go through the pathway, okay, from the womb through the cervix, then into the vagina, and only emerge, all right, into this world basically. So it's in a way a form of good stress, because if you compare a baby having without any problem during pregnancy, basically, compare those delivering vaginally as compared baby undergoing mother need to go for cesarean section or operation to deliver the baby. So if you compare these two groups of babies, those delivered vaginally or normal birth has lesser respiratory problem, all right, or what we call as RDS, respiratory distress syndrome, as compared to babies undergoing seizures, especially in emergency seizures, all right, so section. So it to me is a form of good stress for the baby, you know, but of course for the mother, without any pain relief, is gonna be, how to say, I'm not gonna lie, the pain is really excruciating, right? You feel like everything is going to pop out, and your back is like broken into two. Yeah, definitely it's very painful, but that much of force actually we needed that to push and, you know, make the baby come out through the birth canal. All right, so in a way for the mothers, that's why my professor always tell me, do not victimize the ladies, okay, the woman. We offer them pain relief during labor intrapartum. So for me, the ideal one is at the moment is epidural analgesia. All right, so the one that they actually need to poke at the back of the woman's back, basically, to insert this catheter, and continuous pain relief is given throughout the labor progress. Yeah, and I see a lot of my patient, I would say 99% of my patient is having epidural, and they can even post in Instagram, you know, while trying to go into this labor process.
Okay, so for Dr. Eliza, I had LSCS on my first delivery. Do I really need to wait 2 years before getting pregnant again?
I usually I get a lot of this actually. For me, I will actually see a lot of things. First of all, your age. What is your aim? But then spacing is very important. I wouldn't say exactly 2 years, then you start planning for another baby. You can plan it before 2 years. So by the time your first child is 2 years old, your baby comes out. That is ideal. So for some patients, they actually are chasing time. For instance, they start off at the age of 40 and they had a cesarean section, and then they want to get another baby very soon, for instance. As long as they understand the risk and complications of having a close pregnancy after a cesarean section, then I understand that they want to start fast and start early because the time is ticking and they want to start a second baby soon, then by all means they can, but with precaution. They need extra follow-up, they need care, and then they need a cesarean section in the next pregnancy. But if you're still young, I would actually want the patient to space out, because you need time for your uterus to actually heal. So not actually 2 years and then only start planning, but you can plan before that. So meaning that by the time your baby's 2 years old, you're actually in the midst of pregnancy already. Okay.
Okay, so we have our last question. It's a bit heavyweight. So this one we will put it for both Dr. Eliza and Dr. Mai. So the question is, what are your thoughts on aborting baby once we found out that they have problem? Is it allowed?
you like to answer that? Afterwards.
Okay, if you actually look at the law, by medical law, by the law of the government, it is actually not really illegal. Okay, but the government doesn't do it. But we do it in the medical fraternity. We actually do it if we know that the baby won't survive. But because I used to work in a fetal maternal unit where we see a lot of abnormal babies. If we think that this pregnancy is going to harm the patient's mental status emotionally, that means she can go into depression, for instance, then there is a role of termination of pregnancy.
Let me add
Dr. Mai?
that. Yeah, I agree with Eliza. You see, we have our own act basically about abortion. All right, I think if I'm not mistaken, 1967, and they revised back in 1988. I've actually read 2 articles in Berita Harian and also what's the other one? Utusan, talking about abortion. All right. Yes, I agree with the opinion just now. If indicated, if it's harmed the mother's life, and you will need actually 2 doctors to assess the patient and approve that it is a must to perform this abortion to save the mother's life. All right, regardless whether this is a physical or psychological insult that can triggers the mother to in a way lose her life. All right, so you can do that. But if you do it on purpose because you say, I'm not ready for this pregnancy, you know, you can actually be charged in our law, basically. Right? You can't abort, number one. Number two, the doctor who is helping you to abort this unwanted, so-called unwanted pregnancy can actually be brought to justice. Okay, it's actually wrong without any clear clinical indication to perform such abortion. Okay, I do understand there's a lot of how to say, still a lot of illegal, all right, drugs, namely misoprostol, all right, or cytostat. The government has actually banned it since over the last, I think, 3 or 4, more than that. All right, since, if I'm not mistaken, 2013 or 15. All right, so we have banned it to actually use for abortifacient, all right, or for to perform abortion. All right, but still, it is circulating around the social media. People are still selling it without knowing the harm that it can do to the mother, you know. And our most worried complication is the mother can actually bleed to death. All right, so be careful, do not actually perform so-called illegal abortion. Please seek your doctor advice.
All right, thank you both doctors. That was a very fair and constructive answer. So that comes to an end to our ZÉRA Talks February edition. So we hope that you have gained some valuable insights on pregnancy and postpartum, which you're able to bring along with you on your motherhood journey. So once again, thank you so much to our speakers, Dr. Dahlia and Dr. Dini from Ohana Specialist Hospital, Dr. Mai from Prince Court Medical Center, and also Dr. Eliza from Columbia Asia Hospital, Tebrau. So last but not least, don't forget to enter our ZÉRA Care Box giveaway, which will end by tomorrow at 11:59 p.m. So also don't forget to enjoy your 20% discount from Mums Munch with the code ZÉRAX Mums Munch. So you can find all of this info in our Facebook live video description box. So once again, thank you so much for joining us. Stay safe, stay home, and see you again in March. Good night, everyone. So, yeah. Hi, doctor. Hi.
Hi.
So finally, I got to meet Dr. How to pronounce Eliza or Eliza?
Both okay.
Is it Eliza or Eliza?
Some doctors